IARC data from the World Health Organization, in 2020, 500,000 women in the low and middle income countries have died of breast cancer. Isn't that really disturbing? Should we not do our bit to curb this kind of data coming out? Where should I be? Okay. So these are, as has been extensively discussed, these are the common modalities that we use for screening and detection. Then generally we recommend breast self-examination by the individual herself, clinical breast examination. We also recommend screening mammograms and sonomammography. But we all know there are challenges. One, because patients are not very much aware, they would not come for the test because of the fear of radiation pain associated with mammography. So it is essential that we find something which is non-invasive based on a simple blood test, and this is what we at Apollo and Datar Cancer Genetics are doing. So this is the problem statement. There is an urgent, unmet medical need for a screening test with high sensitivity to detect early stage breast cancers at a reasonable cost and be accessible. So please remember, this sample can be collected from any corner of the country. It doesn't need that the patient come to a tier 1 city. And this is where the technology is moving. So EasyCheck Breast is a simple blood test for screening of early stage breast cancers in asymptomatic. Please note this. This is in normal individuals like me and you. So these are in asymptomatic women based on the detection of breast cancer specific circulating tumor cells. As Mr. Rajan Datar had just alluded to, CTCs are not seen in normal individuals or benign conditions. Circulating tumor cells are only seen in malignancies, and this is the principle on which EasyCheck is based. So we need only 5 ml, and it can be a draw at the convenience of the individual's office or home. Just to give you a simple perspective of the test, this is the blood sample that has been collected. Circulating tumor cells are isolated, and then these are stained with what is called a multiplex fluorescence immunocytochemistry. And these are profiled, and then we say yes, breast cancer specific cells are there, tumor cells are there in the blood or not there. That is all the report says. We do not talk about anything, whether it is positive or negative, and thereafter the breast oncologist would be taking it up with the standard of care tests that are recommended as per guidelines. Why EasyCheck Breast? Because it enables early and accurate detection. It is a non-invasive test. As I told you, it only needs 5 ml of peripheral blood. The test has very high sensitivity, 88.2%, and it is much better than the established techniques. But please note, these are all complementary tools. All of us know that no test, single test is absolutely perfect. But these do help. Specificity more than 99%, and accuracy, that is, it picks where an individual has malignancy or the individual doesn't have malignancy, to the tune of more than 99%. So the trial also showed that the CTCs, or the so-called circulating tumor cells, can be detected in more than 80% of stage 0 cases and more than 90% of stage 1 cases. So it is not only in the advanced cases wherein it is in the stage 3 and 4, it is to the tune of 95 to 100%, because obviously more circulating tumor cells are shed into the circulation. But it is the benefit is that it is also picked up in the very early stages. It is recommended for asymptomatic women who are aged more than 40 years, and also when the individuals come out, there is a report of a positive finding, they have to reach out to the breast oncologist or physician for further care. So as Sir had just alluded to, Trinetra was the first FDA breakthrough device for early stage breast cancer. This is how it's marketed in the US, and these are the accreditations and recognitions of Datar Cancer Genetics. We are CAP, CLIA certified, NABL accredited. These solutions are CE marked in the Europe, and also in the US, the US FDA breakthrough designation status has been obtained. So EasyCheck, please remember, does not aim to replace any standard of care screening methods, but it is a tool to triage your patients or individuals so as to take up the case for further testing. It only aims to reach out to more women who do not come for screening, which is a common situation in our country. So my humble appeal to the print and electronic media, Manavi, please, me andaru circles lo, please create that awareness that any woman has to get herself checked annually, get herself checked for breast cancer screening, which is the commonest cancer, and we can fight this deadly disease with very good results. Thank you for a patient hearing.
Thank you so much, ma'am. Indeed, that's in brief description about how Easy Check Breast would work, and definitely once again requesting media people to please make sure that it would be in greatest awareness spread over as much as we can to make sure that we can make our lovely and beautiful women live out of this cancer, or at least we can detect it and make her cured. Thank you so much. And now, ladies and gentlemen, may I request Dr. Trilok Pratap Singh Bhandari ji, a consultant surgical oncology, Apollo Cancer Center, Hyderabad, and he's a highly experienced and leading surgical oncologist with over 2 decades of experience, to please kindly address the audience.
Good afternoon, Dr. Pratap Reddy sir, Mr. Rajan, Dr. Sudha, and Mr. Dinesh. The preceding speakers before me have spoken already about Easy Check and what is the validity, importance, all those things. So I'm just going to talk briefly about breast cancer, just a few lines about breast cancer. See, breast cancer is the commonest cancer among women as of now. It accounts for nearly 13% of all cancers in India, men and women combined. If you take women alone, it is about 26%. 26% for our population is a very high figure, accounting for nearly 1,80,000 cases per year. All women are destined to get breast cancer at some point in their life, provided they live to 90 to 100 years. As of now, they say that 1 in 22 women will get breast cancer. But the probability of it is that most of them are going to get it till they cross 90 or 100. So now the important thing here is, how do we treat breast cancer? Because breast cancer is going to happen in women. The only important thing here is we need to catch breast cancer at a very, very early stage. As we all know, only 10% of breast cancers are hereditary. Only 10%. And as of now, they are detected by using 2 genes known as BRCA1 and BRCA2. So, patients with family history of breast cancer, you can diagnose them early. Their chances of getting breast cancer by doing 2 gene tests, BRCA1 and BRCA2. But what about the 90% of the patients who are likely to get breast cancer? Now, in this scenario, we have what is known as early screening tools, part of the screening checkup, as we have at Apollo Breast Cancer Clinics and all those kind of things, with mammogram, MRIs, and we have a standard protocol of doing all these tests after the women reach the age of 40 years, where there is no family history of breast cancer. And in cancer survivors and family history of breast cancer, we do them at an early age of about 35 years. So mammogram will be able to catch a lesion which is about 2 to 3 millimeters in size on a screening protocol. And the earliest a woman can feel a lump in the breast is at 1 centimeter. So a woman can only feel a lump in the breast if it is 1 centimeter in size, certainly not before that. A 1 centimeter size lesion in the breast contains 1 million cancer cells. Yes, 1 centimeter size breast lump contains 1 million cancer cells. And these cancer cells very soon get out of the lump and they start circulating. That's why breast cancer is a very dangerous disease, because it is a systemic disease right from the time of inception. So the important thing here is, apart from catching breast cancer with mammogram at an early stage, stage 1, it is even more important to catch breast cancer at stage 0. Meaning to say, before the cancer becomes invasive. And there is a terminology, I will not bother you with that. It's a pathological terminology where we call in situ cancer, stage 0. Even before it is going into the ducts and has started proliferating and has gone into the blood vessels. So Easy Check is one of those technologies which is going to enable us to catch cancer at stage 0. It's very, very important if we are able to catch cancer at stage 0, because apart from catching cancer so early, it will lead to nearly 100% cure rates, one. Second thing what it can do is, the costly treatment protocols when we catch cancer at stage 1 or 2, chemotherapy, radiation therapy, immunotherapy, all those things can be avoided if we catch the cancer at stage 0. So Easy Check, in all probability in conjunction with other screening tools, is going to help us to catch cancer at an extremely early stage, what we call as stage 0. And this will definitely translate into very, very high cure rates, reaching 90 to 95% or even more than that in future. And maybe with easy accessibility of all these tools, we may be able to eradicate breast cancer in the near future. Because as I told you, breast cancer is going to happen to a woman depending upon which stage in life she is. So it's very, very important to catch it early and eradicate it. Thank you.
Thank you so much, sir, for making it easy for all of us by getting this technology to India. And now, ladies and gentlemen, Mr. Dinesh Madhavan, President, Group Oncology and International, has been instrumental in adopting and implementing strategies to further develop international business for Apollo Oncology. I would like to now invite Mr. Dinesh Madhavan ji to please give us a brief introduction to what this collaboration between Apollo Groups of Hospital and Imperial Hospital is all about. May I request Mr. Dinesh Madhavan ji to address the gathering.
Namaste, good afternoon. The collaboration is between Apollo Hospitals and Datar Genetics. A small correction there. Our dignitaries of DIAS are board chairman. Mr. Datar was known for a long time. A remarkable person who's trying to change and bring a paradigm shift in the way the world looks at cancer from the eyes of India. So would be an exemplary clinician. Members of the media who saw this gathering. Your word, what is the magnitude of the problem? And the reason we are here collaboratively is to find solutions. I'm just going to pick up on 3 subject matters which I believe the media here to disseminate to policy makers to make a difference. First, in the state that we are in the city, cancer is not a notifiable disease. Can we change that so that every time somebody gets diagnosed, and every time somebody is being treated or somebody dies of cancer, it gets notified? Because the numbers which you saw is probably just the tip of the iceberg. The magnitude of the problem for a country like India, which does not document much, reports less, and notifies even less, could be multifold than what it is. Because if you do not know what is the actual quantum of people who are dying of disease or living through the disease, or trying to battle cancer, you would not probably take it as seriously as an Apollo or Datar Genetics today is trying to find a solution, because you need to have more people at the policy level to make it notifiable. A couple of states in India have made cancer a notifiable disease, but a small number of it, and we have seen very evidently the changes which is taking place in those states. So I request the media first to see if we could create, through your media, a way to engage with policymakers in this state to create a bill or a pass to make cancer as a notifiable disease. That itself will be a huge step in creating the groundwork of what could be the future of the way cancer should be seen, the way it should be reviewed, the way it should be worked with people like Apollo, Datar, many others. They're very eminent clinicians in very reputable hospitals. Second, why are we going to see deaths here in this country for breast cancer? Because of the lack of a convenient way of doing the test. Because it's a little bit more cumbersome than what is available today through this landmark test which we have come together. True to its name, it's an easy check where through a 5 ml blood sample, you're going to probably nip it in the bud, and that the power to fight or the power to battle cancer starts from there. You need to take the first step. Third, while you might have the best of technologies, exemplary clinicians like Dr. Pandani, oncopathologists like Dr. Sudha, but if you do not get yourself diagnosed early from cancer, you probably might have a less chance of winning over cancer. Probably tomorrow or in the future there'll be a vaccine for cancer, but today the only mantra is earlier it's easier, and it's probably the first step you have to take, and that's probably the only protection you have against winning over cancer or losing to cancer. And I urge the media here to view it from that perspective and see what best you can do so it reaches far and wide. We have created a platform to make it accessible. Like the earlier speakers mentioned, it could be out of your office, it could be out of home, it could be as convenient as it could be. It couldn't be better than that. Thank you so much for supporting this. Thank you.
Thank you so much, sir. And yes, now I open the floor for the Q&A session from the media and the guests. You have any questions on Untitled Chapter? Can you quickly give a mic to the lady, please?